Greetings, my name is Mykuria Jackson. I'm a second year pre-nursing student at Florida A&M University, and I'm from West Palm Beach, Florida.
Greetings, I am Nia Neal, a second year cardiopulmonary science major from Jacksonville, Florida.
Greetings, I am Motayvea Naranjo, a third year biology pre-med student from Miami, Florida.
And greetings, I am Jaida Pearce, a second year pre-professional pharmacy student from Miami, Florida.
The name of our disease is osteosarcoma. Osteo means bone, sarco means tissue, and sarcoma means tumor of bone, muscle, or connective tissue. So osteosarcoma literally means bone cancer. The anatomy involved is the musculoskeletal system. It usually occurs in the bones in the knee or the patella. It starts in the bones and can progress to tissues. It can affect long bones, such as the humerus, the femur, the tibia, and the fibula. Most osteosarcomas occur in children and young adults. They occur in places where the body is still developing, which is why children and young adults are the most affected by osteosarcoma, because the body is still developing. And it can also develop in any bone, such as the pelvis, the shoulder, or the clavicle, and the scapula, and the jaw, or most known as the mandible.
Symptoms of childhood and young adults osteosarcoma, also known as bone cancer, vary from person to person. So this person may not have the same symptoms as another. However, the first symptom is usually an aching pain in a bone or a joint. At first the pain may come, then go away, but sooner than later it will return. Gradually it becomes worse and more intense, often getting worse at night. Symptoms of osteosarcoma vary depending on the location of the tumor. Common signs of this type of cancer include difficulty doing everyday tasks such as moving, walking, or lifting things, limping, pain, tenderness, swelling, or lump close to the joint. Area may be red and warm. You may experience fever, weight loss, broken bones often, and anemia. Symptoms of osteosarcoma can mimic growing pains. The muscles in the cancerous leg or arm may appear a bit smaller than the opposite limb.
So I will be doing the causes of osteosarcoma. Scientists haven't came to a conclusion as to what causes osteosarcoma or why it happens. They have come to the conclusion, and they have found out that DNA changes can trigger cells to be cancerous. These DNA changes turn oncogen, which is a gene that has potential to cause cancer, or turn off tumor suppressor genes, which is a gene that protects a cell from one step on the path of cancer. DNA changes are inherited from one of your parents, which is called inherited mutations. These DNA changes are inherited during your life, but not before birth. Since scientists have not came up with causes, they have came up with factors as to what causes osteosarcoma. They say that from the ages of 10 to 30, teenagers have a higher risk of getting osteosarcoma because of teenage growth spurt. During middle age, the risk goes down, but then it rises again during the ages of 60 to 80. Another factor that they have came up with is height. This is because of rapid bone growth. Another factor is the radiation of bones. This means that if you previously experienced radiation therapy, in the spot that you had radiation therapy, you are likely or have a higher risk of getting osteosarcoma in that spot that you had the therapy in. Another factor is race. African Americans are at higher risk than any other race of getting osteosarcoma. And the last factor is certain bone diseases. If you ever experienced or had a non-cancerous disease, you are also at a higher risk of getting osteosarcoma.
Some of the treatments for osteosarcoma depend on the stage, if it typically involves surgery, chemotherapy, and radiation. Some of the medication used for osteosarcoma is chemotherapy. It is often administered before surgery. This treatment method uses drugs that help shrink and kill cancerous cells. The length of the chemotherapy treatment varies and may depend on whether the cancer has spread to other parts of the body. For example, if your child has cancer and it hasn't spread, the doctor may recommend 6 months of chemotherapy before surgery. Once your child finishes the course of chemotherapy, the surgery will be used to remove any remaining tumors. Some other procedures to remove the osteosarcoma are amputation, bone grafting, and wide local incision. Some of the specialists are orthopedic surgeons, pediatricians, oncologists, primary care providers, or PCP, and radiation oncologists.
In conclusion, for the name, I feel like it is very important that you understand the name and the medical terminology behind it, so it helps you understand what the whole disease is about. The name osteosarcoma literally translates into bone cancer or bone tumor. To conclude the anatomy involved, I feel like it is important to understand what is affected by osteosarcoma. By knowing what is involved, it can also help you understand the disease in more depth.
In conclusion to symptoms of osteosarcoma, I learned and understand that the symptoms are very common and hardly noticed. Those who are affected by this disease are commonly affected in the knee area. Also, most of the people affected do not feel sick, and they only see a doctor when there is some sort of injury. Over the last 30 years of osteosarcoma, it has gone from a disease that was uniformly fatal to one that is potentially curable.
In conclusion, the causes for osteosarcoma are still unclear to this day. Doctors know bone cancer begins as an error in cell's DNA. The error tells the cell to grow and divide in an uncontrolled way. These cells go on living rather than dying at a set time. Doctors have concluded that they have risk factors, which are, as I said in the lesson, which are ages, height, race, radiations to bones, and certain bone diseases.
In conclusion, the treatment for osteosarcoma is often treated with a combination of therapies that can include surgery, chemotherapy, and radiation therapy. Most patients with high-grade tumors receive about 3 months of chemotherapy, known as neoadjuvant therapy. Before surgery, a surgeon will then remove the tumor along with a wide margin of healthy tissue around the tumor, with the goal of leaving the area free of all disease. Most tumors at the bones and joints can be removed safely while sparing the involved limb. A surgeon might use a metal implant and elongate the bone taken from a cadaver, a combination of an implant, a long graft, or a bone taken from the patient in order to replace the tissues that are removed during surgery.